Hey everybody, this is Joshua with the Tendonitis Expert. And on this video, we're going to talk about what keeps jaw joint pain in place, or why won't it go away? So there are essentially three reasons why jaw joint pain exists over time. And it's a little bit irrelevant as to why you have jaw joint pain. Usually it's one of two things. Either there's an impact, injury, not really injury, but just an impact, which starts a mechanism in a certain direction. And there's something like tension. So tightness over time causes problems, generally because you clench and grind, etc. But tension is also a result of impact. So we're not going to talk a lot about the specifics of how you got it in the first place, but we are going to talk about why you have pain at all. And those are the same reasons why it stays there, why it won't go away. So what are the three reasons that jaw joint pain stays in place? You have muscle tightness, an inflammatory response that is chronic, and nutritional insufficiency. And by the way, this also applies to TMJ. When I say jaw joint pain, generally that is TMJ. Well, TMJ is temporomandibular joint, so we're talking TMJD, temporomandibular joint disorder. But it all falls under the general category, the general mechanism of jaw joint pain. And pain exists for a reason. So pain actually exists for three reasons. And this is them: muscle tightness, chronic inflammatory process, and nutritional insufficiency. So let's start with muscle tightness. So notice here that there are a lot of different muscles. This connects to the jaw, this connects to the jaw, this connects to the jaw. And these are just the external muscles. I'm not going to bother putting a picture of the internal muscles, but just imagine there's muscles on the outside of your jaw, and there's muscles on the inside of your jaw as well. And essentially they contract and close. How's that going to work? That's terrible, don't worry about that. So essentially your muscles contract and close the jaw, and then they relax, and that allows laxity or the jaw to open. So when a muscle is too tight for too long, what's happening? For instance, let's say you're in a car crash and you hit your head, or you get punched or kicked by a horse or whatever. This muscle is going to contract, and it's going to pull on the jaw. And it's going to stay tight, so it's going to pull on the jaw 24/7. And when this muscle's tight, just how the body works, this muscle is going to get tight too. And this muscle is going to get tight too. And then these are going to get tight in response to those. And then this is going to get tight. And that's going to compress your scalp down, and it's going to make that tight. And then it's going to go to the other side of your jaw as well. And the whole thing is just gets tight. And then over time, it gets tighter. And that's what causes the tension. You have grinding, you have clenching, you have gnashing, and if nothing else, you just have pressure against the teeth. And that sends a little bit of a feedback loop where pain results in tightness, results in more pain, which results in more pain, and it's just a circular loop. So tightness is a big factor. If you don't deal with if you don't deal with the tightness, then jaw joint pain is going to stay. The next factor is the inflammation response. So essentially, if you have pain, you have some element of inflammation process in play. It's not 100% true, but it's close enough to true to consider it true. So what happens with inflammation? The key thing here is inflammation releases chemicals which enhances your sensitivity to pain. So you have some tightness, you have some pain. Sooner or later, you're going to get chemicals which enhance your sensitivity to pain. And that's going to float through the tissue here. So imagine chemical stuck in the tissue, making your neuroreceptors extra on edge, so that any little thing makes it hurt. Normally it wouldn't, but with that chemical in there, then all of a sudden you have an increase in pain. And when you have pain, that tells the brain there's a problem. And when the brain thinks there's a problem, what does it do? It turns up the muscle tightness. So inflammation process is part of why jaw joint pain stays in place. If you don't get rid of the inflammation process, then jaw joint pain is going to stay. And then there's nutritional insufficiency. So let's imagine that this is your muscle. Muscles, just for the normal contraction and relaxation, require nutrition. It takes calcium to fire a muscle and magnesium to stop firing a muscle. So if your muscles in and around your jaw are supposed to be that length, but now they're this length, and that becomes normal because they don't have enough magnesium to relax back to here, then you can imagine that you're going to have chronically tight muscles nonstop because literally the muscles can't relax because they don't have the nutritional factors they need to be able to relax. Additionally, inflammation eats up nutrition. So when we're looking at your tight jaw, you have tight muscles that are eating up nutrition. You have pain-enhancing chemical that's eating up nutrition. You have pain, which is a stressor, which eats up nutrition. And ultimately what you need to know there is when you don't have the nutrition you need, your muscles literally are stuck this tight. So you get massage, you do other things, it helps for a little bit, but then the pain comes right back. It's because your muscles they literally can't respond adequately. They can't relax because they don't have the nutritional factors necessary to relax. So it just leaves you stuck with your muscles in a tight, shortened state. And that comes back to tightness, comes back to pain, and it's just a loop. Pain, tightness, pain, tightness, pain, tightness. That's part of the downward spiral. So that might not have been as concise as it could have been, but essentially the answer to why won't your jaw pain go away lies in you have to get rid of the muscle tightness, you have to get rid of the inflammation process, and you have to get rid of the nutritional insufficiency if you want your jaw to be able to return to normal function. Because really we're talking function here. Your doctors will look at pain, they'll look at you're stuck with a tight jaw, they'll look at anti-inflammatories and whatnot, muscle relaxants, but what they really should focus on is function. When you return function to normal, pain goes away. So if you'd like to know more about jaw joint pain, TMJD, etc., then visit my website, tendinitisexpert.com, and find the appropriate page.